Hey everyone, so this is my 7 month update video. I was really not gonna make a 7 month video because the changes have been so slow that I'm like, what's the point? Um, but I thought I'd at least make a video saying I'm gonna take a break until my 1 year video. But that might not be the case because I was approved for having top surgery, which is pretty sweet. So I'm going to Dr. Medali and at Cleveland Plastic Surgery in Cleveland, Ohio. So I guess I'll walk you through the steps of getting that approved. First, I went on my partner's insurance because the insurance I have through the university I work for. Um, One of the exceptions is that they will not cover anything related to changing your gender. They won't cover anything, including therapy, hormones, surgery. I got around the therapy by saying that I was having anxiety and depression and anger, which I was having, and I just didn't bring up the whole gender issue that was going on underneath all of that. So it worked out. I got a great therapist. I still see her, and I went on my partner's insurance, but I kept my old insurance just because I like my therapist and I didn't want to have to look for a new one. And it's not that expensive, so that was great. That was great. So I went on to her insurance, that specifically covers sex reassignment surgery. Some of them. Um, so so she researched that before I went on to Krista's um, insurance, and the only thing I needed was a letter from my therapist for top surgery. For top surgery, you can go under their medical coverage and just read what they outline, but it said one letter from a therapist for top surgery. For bottom surgery, which they cover partially, both metoidioplasty and phalloplasty, they cover parts of. But for bottom surgery, you have to be on testosterone for a year, and you need two letters from a therapist, or one letter from a therapist and one letter from a doctor. And a therapy letter has to say that you've been diagnosed with gender identity disorder. So that was another thing to make sure to put in the letter. So I talked to Dr. Medali's secretary, filled out the paperwork, which was just background, my medical history. So I had to fill out a form that was on the website, which was like 2 pages. So that was fine. I scanned it in and emailed it. And I had to take pictures of my chest. I had to take a picture from the front, and then one from my left side and one from my right side. It's better if you don't hold the camera. You have to get someone else to take your pictures. Since it's in Ohio and I'm in Wisconsin, so it's not like I can go in for him to see me and tell me what I'm going to get done. So he said that he's pretty confident in being able to tell people what surgery they're going to get, either the double lateral mastectomy where they cut under here and have the drains and you can get nipple grafts, or what I'm hoping for is basically the liposuction. It's called keyhole or periareolar, which means around the areola, where he makes the incision around your areola and then sucks out the fat and then sutures it back together. But you have to be a small bead, a cup for that surgery. Works the best. So that's what I'm hoping for. So send in the paperwork. Secretary got back to me. I needed to call them first so that they could send the codes to my insurance. My insurance approved it after about 3 weeks. Um, I got a letter in the mail and I got an email from them. And then after that, I've been emailing back and forth with the secretary about payment. about pre-surgery. So I got lots of forms about pre-surgery. And two important things pre-surgery. Dr. Madali is going to call me on the phone to talk about the procedure so I don't have to go in a day before the surgery. And second, I'm going to get a call a few days later from the nurse just to verify my patient history stuff. So that saves in having to go a day before your surgery to meet with the doctor, doing it all over the phone. I mean, according to their older information, it said that I'd have to go in a day early, but I guess they changed that to where they do most of it over the phone now, and I just have to be in Ohio for my surgery. And then I believe a week later, let me count the days, it's the 22nd, and then on the 27th. Okay, 5 days after my surgery, that's whenever my post-op meeting with Dr. Madali is to see how everything's healing up. So that's really exciting. Krista keeps bringing up how it's really soon, and I just keep thinking to myself how it's not soon enough. Krista keeps texting me how it's not soon enough, so that's pretty awesome. I have to mention that I went to a website. I can't remember the name of it now. Maybe I'll put a link for it underneath in like the comment section. But there is a surgical website for FTMs, and they have binders that are specifically for post-op. So I bought one binder that zips up and it has sleeves. And I bought another binder that has the clasps for 3 different sizes because I'm not sure how big I'll be with the swelling and the healing. So I got the clasp one for size reasons and the zip up one just for ease because I mean it's gonna be sore and yeah, it's just gonna be easier to just zip it up and be done than to go up the side. So I mean they're pretty expensive. They're like $170 each, but I keloid whenever I get injured. So I was in a car accident whenever I was 7. So so I've had surgery, but you can still see like the scars which have faded over time. But that's just pretty much how I heal. And so when I keloid, it means you get an original injury, and then when you heal, sometimes it like heals outside of the original boundary, so it gets a little raised. Some more so than others. And this I've actually had plastic surgery to help decrease its appearance. But I don't want that to happen around my nipples, so I'm extra anal about the compression because it's the only thing that helps stop that whole healing raising thing is keeping lots of pressure on it. And then of course I invested in the silicone uh, scar pads and the gel that you put on there because I just know that I'm not the best healer in the world, so I'm gonna nip that in the bud so I can have the best chest ever. So I'll try an update after I have surgery, but don't expect to see my chest for like a month or two after because people post pictures that, look great. You have to keep in mind that they're still healing. But then some people get frightened away by it, so I don't want to frighten anyone off of having the surgery. Or if I do, I'll post it and then I'll make sure to post some 6 month later pictures so that people browsing the internet won't be too afraid of getting top surgery because I just cannot wait. I've had dreams about walking down the beach with my partner and just being so happy and seeing kids running around on the beach and playing and screaming and then just it's just magical. I can't wait for it not to be a dream. And even if I don't have the best chest in the world, it's still going to be awesome. And there's lots that I can do to help the healing process. And even if there are scars, I've gotten tattoos. You can get tattoos to cover it up. Lots of trans guys get tattoos on their chest to cover up their top surgery scars. I've been looking at more tattoos anyway. That's gonna be great. So 7 months, not much different. Hair is growing in faster, guys. It grows in ridiculously fast now, but still not much facial hair. and I'm just not the hairiest guy in the world, so it's gonna be a slow process of growing in facial hair, which I've accepted. My voice is getting deeper, still not deep enough for me. Some days I feel like my voice is deep enough to be recognizably, unmistakably male, and then other days I feel like my voice is as high as my partner's. So, I mean, it's definitely partially mental, partially just the reality of things, that changes don't happen fast enough. So, I'm coming up on 10 minutes. The video is going a little long. I won't post another video until either before my surgery or after my surgery, and then definitely look forward to some like 3 month post-op surgery videos and pictures. And I'm not going to make another video updating about testosterone changes until a year, because things have just slowed down dramatically. The changes were faster in like the first 3, 4, 5 months, and then they're slowing down. So yeah, thanks for watching. Final muscle picture. Yeah, see ya.